Infertility is defined as the inability to conceive after 1 year or more of unprotected sexual activity. Approximately 1 in 6 individuals of reproductive age worldwide will experience infertility in their lifespan. Now, ovulation is the release of an egg from one of the ovaries. It often occurs around day 14 of menstrual cycle. Pituitary gland in the brain stimulates one of the ovaries to release an egg. The wall of the ovarian follicle ruptures at the surface of the ovary and the egg is released. So, when the ovary fails to release an egg during the menstrual cycle, this is what we call an ovulation. Finger-like structures called fimbriae sweep the egg into fallopian tube and the egg travels through it, propelled in part by contraction of the fallopian tube walls. During fertilization, the sperm and egg unite in one of the fallopian tubes to form a zygote. As soon as one lucky sperm cell succeeds in penetrating the egg immediately undergoes a chemical reaction that prevents other sperm cells from following suit. Then, the chromosome carried by the sperm and egg come together and the egg is officially fertilized.
Let's take a look on the end ovulation factors. Hypothalamic and pituitary dysfunction. As we know, both of these are important in releasing hormones that are needed for ovulation. Low level of FSH prevent the follicle from develop properly and low level of LH prevent the LH from surging. Without LH surge, eggs will not be released. Next is PCOS. Women with PCOS cannot ovulate because the antral follicle has arrested their development due to the hyperandrogenism. Instead of growing and maturing, the follicle will remain accumulate in the ovaries. Thirdly is thyroid dysfunction. Hyperprolactinemia may occur and suppress the secretion of FSH and LH that are needed for ovulation. Lastly is ovarian failure, which the ovaries stop functioning before age 40. Thus, ovary will not produce egg and release estrogen regularly.
Infertilization can be caused by both male and female. Commonly, fertilization in male can be measured by semen analysis and few parameters will be looked into, such as sperm concentration, motility, and morphology, and also presence of leukocyte in fertilization may fail to occur due to oligospermia, low amount of concentration of sperm, where a man has fewer than 15 million sperm per milliliter of semen. Fertilization may fail to occur due to oligospermia, low amount of concentration, where there is no sperm in semen, Parespermia where white blood cells present in semen, and necrospermia which result in dead sperm. Besides, erectile dysfunction, loss of libido, and low testosterone level also can affect men. These abnormalities may result from cystic fibrosis, blockage in testicle, taking excessive medication, smoking, which may impair sperm production. Infertilization caused by females can be related to an ovulation factors, fallopian tube blockage, uterine or cervical abnormalities, endometriosis, and treatment for cancer. The egg to be unable to fertilize.
Now, let me continue with treatments and strategies. The first factor, which is hypothalamus or pituitary dysfunction, the treatment that can be used is hormone replacement therapy. If FSH levels are too low, the doctor may prescribe hormone replacement therapy with phenotropin alpha. If LH levels are too low, there have two treatments, which are estrogen replacement therapy and also gonadotropin treatment. Second factor is polycystic ovary syndrome, which can be treated by changing diet activities, as it can help the body to use insulin efficiently and helps in the ovulate. It also can be treated by using medicine such as clomiphene citrate, which helps to encourage monthly release of an egg from ovaries. Next factor is thyroid dysfunction. The doctor might give thyroid hormone medicine called levothyroxine to return the hormones level to a healthy range. Ovarian failure. The treatment is hormone replacement therapy that can improve sexual health and produce estrogen and other hormones that the ovaries are not making. The doctor also might suggest for in vitro fertilization or IVF. The last factor, which is fertility in men, can be treated by taking supplements such as vitamin C and vitamin E to reduce oxidative stress that damage the sperm, improve sperm's quality, and also increase testosterone levels. Lastly, the treatment that can be used is surgical sperm retrieval techniques that will be used for men with blockage.
To sum up, there are two aspects that can be looked to analyze fertility, which are anovulation and failure of fertilization. In this case, both men and women have same potential to become infertile. Here is the factors that leads to anovulation and failure in fertilization, such as imbalance of hormone in the ovaries, polycystic ovarian syndrome, ovarian failure, and oligospermia. However, infertility is not a permanent condition. The underlying causes of anovulation and failure of fertilization, or the issue that is affecting hormone levels, can be diagnosed and treated. In most cases, people and couples with infertility have a high chance of pregnancy with numerous treatments available. Things like medication, surgical treatment, taking supplement, or assisted reproductive technology such as IVF can help. Also, changing your lifestyle to a healthy one can improve your chance of pregnancy. With the availability of new technology, more people may now undergo fertility treatment, and success rates and safety are continually increasing.